Hello, my name is Dr. Lauren Quetch. I'm a professor here at the University of Arkansas in the Department of Psychological Sciences. I'm also the director of the Family and Community Intervention Lab. The Family and Community Intervention Lab, as well as the Psychological Clinic, are located in the university on the first floor of Memorial Hall. When families come in for treatment, they first walk into the Psychological Clinic, are checked in, and sit in the waiting room. Here in the Family and Community Intervention Lab, our research focuses on building and adapting evidence-based treatments for families of children with disruptive behaviors. We take a family-centered approach and focus on teaching caregivers the skills they need to help reduce disruptive behaviors and to build a stronger parent-child relationship. My goal in starting this lab was to provide services for families within the community that needed it most. And I believe that through our efforts, we can hopefully provide new knowledge and create lasting impact for these families so that they can live happier lives and live lives where they can enjoy spending time with their children. Often, unfortunately, community behavioral agencies are too overwhelmed with work to be able to provide the services that families need. In our psychological clinic, we're happy to provide services for families and get them in quickly so that they can see the changes they need to see as soon as possible. We provide parent-child interaction therapy and evidence-based treatment for children between the ages of 2 and 7 with disruptive behaviors. Unique aspects of parent-child interaction therapy include that the parent is the one in the room learning these skills, and so they are becoming the therapist over time. They're coached in real time and provided feedback from a trained therapist on how to play with their child and how to reduce the likelihood of disruptive behaviors. There's a lot of evidence to support that parent-child interaction therapy works. It's really effective and it has long-term outcomes for both families and children. Our clinic provides services to all families and children. We have specific equipment in order to provide these services. So families will be provided a Bluetooth in which they place in their ear while they play with their child in the family room. And then the therapist will be behind a one-way mirror providing them one-on-one coaching and immediate feedback in the moment. The therapist will hear everything that's going on during the parent-child interaction while also keeping an eye to make sure that the child always stays safe. Our family room is unique for a number of reasons. First, there's a lot of space for caregivers and children to play on the floor and on tables and to interact in a positive manner. This helps build a stronger parent-child relationship as well as allows the parent to work on effective and consistent discipline strategies. Parent-child interaction therapy takes place weekly for about 1 hour, and this can happen over the course of 3 months to 6 months depending on the level of intervention that the family needs.
Nice behavior descriptions, Cameron. Try using a labeled praise. Oh, I love how gently you're playing with the toys. Great behavior description. Nice using labeled praise. That means she'll do more of that behavior in the future.
You have an orange block in your hand.
Oh wow, good job describing what he's doing. Oh, he's having so much fun playing with you.
Mr. Martinez.
Oh wow, good job narrating what he's doing. Good reflection. You're letting him know that you're with him and you're following him.
One of the areas of focus that we have is providing services for families of children with autism spectrum disorder. I noticed that many families that have children on the spectrum have high levels of stress, have high needs, and those needs are not being met. And so my goal was to recognize how can we best serve these families within the community. With these services, I hope to reduce the stress that many of these caregivers feel and to also increase the quality of life for many of these children. Parent-child interaction therapy has 40 years of research to show that it is effective at reducing child disruptive behaviors and improving the parent-child relationship. If you are a family that has a child with disruptive behaviors, we are happy to provide services, and you can rest assured knowing your relationship with your child will improve and those disruptive behaviors will also be reduced. If you have a child with autism spectrum disorder, we are also happy to provide services and help reduce some of those disruptive behaviors that go along sometimes with having a child on the spectrum. So if a family is interested in receiving services for disruptive behaviors for their children, especially kids between the ages of 2 and 7, then we're happy to provide those services here in the Psychological Clinic.